All right, let's welcome Dr. Joe McGinley in our SMX medical update. Obviously, we want to get an update on thumb injuries due to what has happened to Jett Lawrence. So, the Honda put out a pretty detailed press release. So, you've got some information. What are you thinking on prognosis for Jett?
Yeah, we talked about this on the Race Day Live. I think we're going to start calling this motocross thumb based on your suggestion. So great detail from Honda on this injury. Unfortunate for Jett that this happened, practice crash. In medicine, this is called skier's thumb. And essentially what it is hyperextension of the thumb. And it's right at the joint of your knuckle. So right at the knuckle, it gets hyperextended back and tears the ligament that holds that thumb stable in place. So if you have an injury where that ligament tears and is unstable, it's really hard to hold it and grip on the motorcycle. So based on the report from Honda and the interview that Jett gave, he ended up requiring surgery. He actually had a small chip fracture in there as well, requiring surgery. That's going to put him out for the rest of the motocross season, but hopefully we'll see him back for the SMX.
So with an injury like this, and motocross riders, I'm sure you know, are notorious for trying to cut corners, trying to save an hour, let alone a day or a week or a month off an injury. With a tight time frame like this, him wanting to get back for Charlotte for the opener of SMX playoffs, is there anything he can do? Therapies, things he can do behind the scenes? He works with Doc G. I'm sure he will be daily. Is there anything you can think of that could speed up that process? Or, what's the quickest turnaround you really think is reasonable here?
Yeah, absolutely. Based on the information, again, there's 6 types of injuries for the UCL. He's likely in that category 5 or 6 requiring surgery. After you have surgery, you need that area to heal up, but there's different surgical techniques. Sometimes they'll do internal bracing to provide more stability of that ligament. And then afterwards, treating it in a typical way for recovery, there are tips and tricks. There's a lot of new science out there. Some orthopedic practices will use laser therapy to enhance healing in that area. You can use wearable ultrasound devices on those ligaments, which will also help heal it. At our practice and others around the country, they do cell therapy. So PRP and stem cells is really big in the injury recovery realm and helps get the rider back out there sooner than later. So based on what we're seeing, again, I think all indications are that he will be back by that Charlotte round. He's doing all the right things, seeing the best surgeons in the country, and yeah, look forward to seeing him back on the bike.
All right, and we'll look forward to seeing you next week.
Thanks, guys.